At one time or another, most adults have experienced low back pain. It can be as a result of awkward or repetitive lifting, bending, or twisting. Sometimes there is no reason for the onset of low back pain. Fortunately, about 70% of people with low back pain get better within 2 weeks, and 92% get better within 4 to 6 weeks through the natural course of healing. Even when it's not serious, low back pain can be very uncomfortable. It may also limit your activity, preventing you from doing normal things that you enjoy. We're going to take a few minutes to explain a few common types of low back pain, simple ways to treat it, and when you should seek more specialized treatments. We'll also show you how to do some simple exercises that may help your recovery and prevent low back pain from returning. You might think of this as a roadmap to recovery if you are experiencing low back pain. Hopefully you'll find this stay active approach helpful and reassuring. Please keep in mind that this information is not a substitute for professional medical advice, diagnosis, or treatment. Your doctor is in the best position to diagnose and treat your specific situation. So you should follow his or her advice even if it differs from the information in this program. I'm going to talk about 3 common types of low back ailments. The first, acute low back pain, is the most common. It usually improves after a few days of simple care. Second, acute sciatica, which is usually caused by irritation of the sciatic nerve with the pain radiating from the lower back to the lower extremities, sometimes all the way to the foot. This type of pain can last for 6 weeks or less with proper treatment. Third is chronic low back pain and sciatica that lasts longer than 6 weeks. This may require specialized treatment. Your doctor may refer you to a medical specialist for treatment if your back pain doesn't respond to conservative treatment and lasts more than 6 weeks. Occasionally, people have other medical conditions that produce low back pain. If your doctor suspects such a condition, he or she may request certain tests, X-rays, a CT scan, or an MRI. Make sure you let your doctor know if you experience conditions like unexplained weight loss, fever, urinary difficulties, leg weakness, or constant pain at night. If you have acute low back pain or sciatica without these other medical conditions, what are some of the simple treatments that might bring you relief? Anti-inflammatory medications, such as ibuprofen or aspirin, can help ease the pain and swelling in the lower back. If these medications tend to upset your stomach, use acetaminophen. This is the generic form of Tylenol. Your doctor might prescribe muscle relaxants if you have muscle spasms, but you should use caution when taking these because they can cause drowsiness. Good posture when standing or sitting will reduce stress on the back muscles and reduce your pain. When sitting, you may find it helpful to put a small pillow behind your lower back. When sleeping, try to lie on your back with a pillow under your knees or lie on your side with a pillow between your lower legs. When you return to work or your usual daily activity, avoid lifting heavy objects and repetitive bending and twisting as much as possible. Managing your stress from work or family life also may help your recovery from low back pain. If you experience severe pain or no improvement after 2 weeks of conservative treatment, like those I've just described, your doctor may recommend therapy. Typically, therapy is provided by a physical therapist, chiropractor, or an osteopathic physician. This therapy may include special exercises, manual techniques such as spinal mobilization or massage. Surgery is usually not needed for back pain or sciatica. Only 5 to 10% of patients with low back pain need surgery. Generally speaking, walking is a great exercise to help you recover from low back pain and help prevent further back problems. Swimming or exercises in the water also improve low back strength. Losing weight also reduces stress on your lower back and may help you avoid back problems. Elliptical machines and exercise bikes can also benefit your back as well as your overall health. This should be done for 20 to 30 minutes a day, but of course, consult your personal physician before starting this program. Now, here are 3 simple exercises you can do at home to strengthen your back muscles and prevent further back problems. As with any exercise, you should discontinue doing these if they make your back pain worse. Here's Christy Coleman, a physical therapist, to explain how to do these exercises.
The best place to do these exercises we are showing is on the floor. However, if you are unable to get to and from the floor, find a firm surface in your home that provides you easy access. Your physician will recommend the number of repetitions you should do each time and how many times a day you should do this. We suggest starting with 10 reps of every exercise. The first exercise is called the deep abdominal contraction or pelvic tilt. To perform this exercise, lie on your back with your knees comfortably bent. Arch and flatten your back until you find your most comfortable or pain-free position. Once you have found this position, draw your stomach muscles in while you exhale. You should hold this position for approximately 5 seconds and then relax. The second exercise is called the alternate knee to chest. To perform this exercise, start with your hips and your knees comfortably bent. Pull one knee towards your chest as far as you feel comfortable. Hold for about 2 seconds and then return to start position. Repeat the same movement with the other leg. If pain is produced or worsened when returning to the starting position, discontinue the exercise and contact your physician. This exercise is called a press-up. To perform this exercise, lie on your stomach with your hands under your chest, as if you were going to do a push-up. From this position, press up with your chest and your shoulders so that the lower half of your body remains in contact with the floor. As you progress with this exercise, you may be able to eventually straighten your elbows. If pain is produced or worsened when returning to the starting position, discontinue the exercise and contact your physician. We suggest you try doing all of these exercises. If you experience pain or worsening of symptoms, you should stop immediately. A worsening of your pain may be the pain traveling to another location or a pain of a higher intensity following the exercise. Most people find that doing these exercises every day will speed up their recovery from low back pain and reduce the chances of suffering low back pain in the future. Remember, if your back pain persists longer than 6 weeks, talk to your doctor about a possible need for further diagnostic tests or more aggressive treatments. Any of the exercises that improve your symptoms may be repeated more often.
If after 6 weeks your symptoms have not improved, contact your physician, as he or she may want to refer you for additional testing such as an MRI, CT scan, or X-rays. Depending on the seriousness of your low back pain, your physician may order steroid injections. These injections may ease pain or swelling that is more intense, or your doctor may prescribe steroid pills instead of injections. Following these guidelines will help you be in control of your low back pain.